Hi, welcome back to Pills and Bills. I'm a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this top 200 drugs coloring book by myself to help med, nursing, pharmacy students, and techs learn smarter. So grab a pencil, let's color, review, and make these drugs stick together. All right, today we're talking colchicine, brand name Colchris. It's a small but powerful anti-inflammatory that helps target gout at the cellular level. The primary pathophys of gout involves urate crystal formation in places they shouldn't be, like the joints and connective tissues. Although we typically can't visualize them, I'm going to color the brand name a yellowish brown color, as that's the typical color that urate crystals are. Okay, before we move on, let me explain this research-backed memory tool we created called PharmaLink Phrases. Throughout the book, we use word links from both the brand and generic name to connect them into one logical, memorable sentence and anchor that to a custom illustration for you to color. We use them throughout the book to turn dry pharmacology names into quick, memorable hooks that your brain grabs onto instantly. Some of them might seem more silly than others, but it's backed by neuroscience showing that visual-verbal pairing supercharges how fast you learn and how long you remember. Now flipping back to our page, you'll see our first PharmaLink phrase and the components of colchicine as well as Colchris in the logical sentence. Okay, mechanism of action. Colchicine works by entering neutrophils and disrupting their microtubules. Because those microtubules act as the cell's transport tracks, it ends up blocking them from being able to migrate into the joint. That migration is what triggers that intense enzyme and cytokine release that makes that gout flare so painful. So bottom line, reduced inflammatory cells, reduced pain. It does not affect uric acid at all. So because of this, colchicine works best when you start it as early as possible, ideally within the first 12 to 24 hours, because the longer the neutrophils have to swarm the joint, the harder they are to shut down. Okay, flipping to our indications for colchicine, we primarily use it in gout flares, for gout flare prevention, as well as in familial Mediterranean fever. There's also some off-label indications not mentioned here, such as pericarditis. An important clinical pearl, hydration is a must with colchicine. Staying well hydrated helps protect your kidneys, it supports uric acid clearance, and then reduces the risk of potentially worsening GI effects. Colchicine is cleared through the kidneys and the gut, so dehydration can concentrate the drug in the body and increase the potential for adverse effects. Okay, side effects. Colchicine's biggest calling card is GI upset, nausea, vomiting, cramping, and especially diarrhea, which all can be common and dose-limiting. It's helpful to counsel patients on this point so that they know, given it's the first sign of major toxicity. Colchicine toxicity has a pretty classic progression. Early GI distress, then muscle weakness, numbness